welcome to Spectrum Health TV. I'm joined by Dr. Greg Golladay, orthopedic surgeon at Spectrum Health, to talk about knee replacement surgery. Welcome, Dr. Golladay.
Thank you for having me.
First question I have for you is, when is a patient a candidate for knee replacement surgery?
Most of our patients are in their 50s or 60s. Our average patient is actually 67 years old, so usually this is an operation for older patients. Typically, they've had symptoms ongoing for a period of months to years, and they've usually tried other treatments like medications, braces, or injections, and despite those measures, they have pain that interferes with their daily functioning and quality of life. We also look for patients to have advanced findings on their x-rays, bone-on-bone arthritis. So they've really tried everything else, and it's time to do something more.
And so what does the surgery entail?
Knee replacement is, I think, commonly misunderstood. It's more resurfacing of the joint. Once the patient's under anesthesia, we open up the knee joint and we shave a small layer of remaining cartilage and bone from the end of the thigh bone and the top of the shin bone and the back side of the kneecap. Those parts that are shaved off are replaced with artificial parts of metal and plastic that are typically adhered to the bone using an adhesive. In between the upper and lower parts, we place a piece of plastic that snaps into the lower piece, or the tibial component, and that replaces the cartilage surface.
So what is the recovery like? How long are you in the hospital?
The average patient in our hospital stays about 3 days. The first day is surgery, and that day is usually pretty restful for the patient. The next day, they begin physical therapy, and by the day after, they're getting more mobile and independent on their own. Usually by the following day, or that third day after the surgery, they're usually ready to go home, and most patients go directly to home and then start the outpatient therapy process at that point.
And so how long before they're back up on their feet and functioning fairly normally?
Well, it really depends on the person, just like anything else. On average, I would tell patients that they should plan to take 2 to 3 months to recover, but generally they're making small baby step improvements beyond that for 12 to 18 months. So there's really a long recovery process. The biggest changes are in the first few weeks as they start to get their feet back under them. They begin to get the range of motion and strength back to the leg, and they're able to walk more and more independently and start to do normal things. But the strength and the stability and so forth take usually 2 to 3 months to come back.
So what should you do if you think you are a candidate for knee replacement surgery?
Well, I would always encourage a patient to see their doctor first, because most primary care physicians will have an idea of what's going on with the patient as a whole person, and they'll have an idea of what the history is behind the troubles that they've had. Usually starting with a simple x-ray and examination, they may determine that that patient then needs to be referred to an orthopedic specialist. At that point in time, once the visit with the orthopedic surgeon has been scheduled and they undergo that initial evaluation, the determination can be made as far as what the best treatment would be beyond that.
Well, this has all been very helpful information. I appreciate you sharing it with us.
Thank you.
And thank you for joining us for this edition of Spectrum Health TV.